Alright, welcome to the video lecture on pharmacology, and we're going to go over some very basic material that will increase in the content as we move forward. But it's probably wise to go over some of the enzyme videos before you start this playlist. So the first thing that we're going to talk about is, in this lecture at least, we're really going to focus on drug administration. And so I have included some but not all of the possible routes for drug administration. I've kind of grouped oral and inhalation into one, but we will see there are some distinct differences, some very important differences between the two. The intravenous, intramuscular, and subcutaneous drug administration is abbreviated by the IVIMSC respectively. Then we have topical administration, which is like ointments and that kind of thing. We'll talk a little bit about transdermal patches, rectal administration, and sublingual administration. And so oral administration here is the most common form of administration. I mean, I'm sure most of us have all taken a pill at some point, and so pretty obvious player in our mix of forms of administration. The oral administration is important to note, as we'll see. It's limited a little bit by two things, one of which is listed here, which is the harsh environment of GI, which references gastrointestinal environment, that can limit its absorption a little bit, because we have to remember in the stomach it's very acidic, and it's so acidic that it breaks substances down prior to absorption that occurs in the small intestine. So the stomach is going to break down a lot of our food, but also it can break down these drugs and in turn, in some way or another, decrease the potency or the absorption that we will get from that drug. So here, there's two pathways that are important. Let's start with this one that goes down here. So if I were to orally administer a drug, I'd go down the swallowed fraction arrow, and I'd get to, I'd go through my mouth, through my esophagus, into my stomach. And the stomach, like we said, is very acidic, and so it would begin to break down that drug, and eventually this sphincter here, it's called the pyloric sphincter, would lead to my duodenum, and there I would be able to absorb that drug, and essentially from there I would go through a vein called the portal vein that would lead to the liver. So I know this pathway is kind of complicated, so again, this is something we're going to be going over this a lot, but again, through the esophagus, through the stomach, through the duodenum, and eventually, through the small intestine, and eventually a lot of these nutrients will go through the portal vein to the liver, and in the liver, the drug will be metabolized, and then it will enter systemic circulation. So it'll go throughout your body, through your blood, and it will go to the tissues of your body. Whereas if you inhale a drug, it'll go directly to your lungs, and it will be go from the lungs and be absorbed directly to the systemic circulation. The important piece here is that if you inhale a drug, you're going to bypass this liver metabolism. You're going to bypass this very acidic, harsh GI part of your stomach. So that's the really important difference between inhaling a drug and taking an oral drug. Now, here, these administrations, you're probably familiar with most of these. Intravenous is listed, is a picture of this is on the side, intramuscular, and then subcutaneous. The one thing you'll notice is the angle at which these needles are being held at are going to change depending on the type of injection we're giving. You can see subcutaneous is 90-degree injection, whereas like the intravenous is 30 to 45 degrees. You'll also see that when you're injecting directly, you're again bypassing the harsh GI environment. You're also bypassing this so-called first pass metabolism, which is in reference to the liver. The liver metabolism will break down a drug, like we talked about, will metabolize it, and the GI environment of that really acidic environment in the stomach will also break down a drug. And so if we're bypassing those, we're going to get a much higher concentration of drug delivered to our tissues when we do the intravenous, intramuscular, or subcutaneous injections. The one disadvantage that is important to note is that you may introduce bacteria at the site of injection, which is why we usually are very careful to sterilize. There's also some forms of topical administration, used to treat a local area. If we're trying to treat something that's, systemic throughout our body, it's very difficult to do that with topical administration. But if it's, eczema, or we have a pimple demonstrated there, those things are more commonly used with topical administration. Transdermal patches, like a nicotine patch, those are very effective at delivering drugs systemically into the blood. So a little bit different from the topical solution that was mentioned in the previous slide. These are used for a sustained delivery of drug. That's very important. They're used for drugs, for a drug that you want to continually be released into the blood. Okay, so it's a little different than having a high dose of just the drug at one point in time. Rather, you get the drug continuously over a period of time. Rectal administration, it's very useful for drugs that induce vomiting, as listed on here, for obvious reasons. Also, if patient's unconscious and you want to limit your risks, you can do a rectal administration. Again, when we talk about the type of metabolism this drug is going to see, you're going to get about 50% of the drug that is going to bypass the portal circulation. Again, that's referring to the liver, where the liver is going to break down the drug. So you're going to get about 50% of it bypassing, 50% of it going through the liver. Also, the drug will also bypass the gastric enzymes and the low pH of the stomach. So rather potent relative to oral administration is rectal administration, but again, not quite as potent as if you were to directly inject intravenously into the body. Also, there are some disadvantages with going this route, one of which is the irritation that the rectal mucosa can suffer, and a lot of times the potency referred to, if the drug is completely absorbed, then yes, you do have somewhat more potent than oral administration. But another problem is sometimes you don't get full absorption when you do this rectally. So it's mostly used for antiemetic agents, which we'll talk about shortly, I'm sure. All right, here we have sublingual administration, which is not to be confused with oral administration. In this case, you put a drug under your tongue, and it diffuses directly into your bloodstream, and it enters your systemic circulation directly. So why is this important? Well, two big reasons. Again, we avoid the first pass metabolism, we avoid the liver, and we're avoiding that harsh GI conditions. So again, potency of the drug. If I was going to give somebody a drug orally versus sublingually, the sublingual drug would have significantly less potency than the drug that would be delivered orally, because I know that sublingual drug is going to immediately enter systemic circulation, whereas the oral administration, we would have to bypass the GI and the liver. Drug absorption usually occurs in the duodenum. That's due to the large absorptive surface. If you're familiar a little bit with anatomy going into these lectures, you'll know that the small intestine is the site where most absorption occurs, particularly the duodenum, which is the first branch that comes off of the stomach, is really where we get our nutrient and drug absorption. So if we follow this table here, we can see that the small intestine absorbs products of digestion with the microvilli and whatnot. And again, this is true for drugs. So the nutrient molecules then travel through the portal vein. It's the hepatic portal vein. Hepato is just refers to liver. So when we say hepato, that means liver. So the portal vein goes to the liver, and then the blood eventually will leave. After it's metabolized, the blood will then enter general circulation with the drug from these hepatic veins. So again, we go from the small intestine through the portal vein to the liver. Metabolism occurs of the drug. So we're going to lose some of that drug, right? It's going to metabolize, and then it's going to branch off through the hepatic vein into systemic circulation. You can see that again here. It's not important that you distinguish the splenic vein versus the superior mesenteric vein. It's more important that you just understand that from the small intestine, the drugs will go through the hepatic portal veins of the liver, through the hepatic veins, into the inferior vena cava, and then eventually into systemic circulation through the heart. Okay? So this is really going over what we just talked about. Drugs first pass through metabolism by the liver. That's why it's called first pass metabolism. It's kind of where the term comes from, and you can see that eventually then the drug will enter systemic circulation. So first pass metabolism consideration that we want to talk about is specific to the quantities of drug that you're going to need, and we talked about this when we said that we can compare oral administration and sublingual. In that sublingual, we're bypassing this process, so you might not need as heavy of a dose as you would if you did the oral administration. So you have to kind of compensate for the fact that you're going to lose a little bit, or a lot in some cases, when you when you administer drugs orally, because the oral administration, you can have to keep in mind that you're going to be bypassing the stomach, the GI tract, and the liver. So also, a lot of times we take pills with food, so this can alter the absorption we get from our drug, and that's because when we're in the stomach, we have all of this food in our stomach, and we can delay the emptying of the stomach, and then drugs can get destroyed by the acid of the stomach, and therefore they will be unavailable for absorption. So when you take food with drugs, you're decreasing not always, but you can influence the absorption by decreasing the absorption, because the drugs are more likely to be destroyed by the acid. Now, factors that affect absorption, if your intestinal pH usually is around 7. This is not to be confused with the pH of the stomach, which is around 2. It's actually more like 1.5. That is. So if your intestinal pH shifts, that will affect the absorption, right? Because you might break down more of the drug. If you take the drug with food, that will slow the transit and delay the drug absorption. There's also some drugs that are sustained release preparation drugs, which have a coating around the drug called the enteric coating, which essentially prevents the drug from being broken down by acid, and therefore allowing a higher dose of the drug to make way to systemic circulation or to your tissues. If you have gastrointestinal diseases, we'll talk a lot about those, or inability to uptake the drug, malabsorption syndromes. Some common ones involve the inability to absorb nutrients like vitamin B12 and iron. So a half-life is some given amount of time that it takes for a drug to reach 50% of its concentration, and 2 half-lives would be 25%, and 3 would be 12.5%, and so on. So the question is, how long does it take to reach 95% steady state concentration? So in other words, essentially to deliver 95% of the drug systemically. Well, if we break it down, we can see that, one half-life, like we said, is 50, 2, 25, and so on. So we know that 4 half-lives is about 6.25%. So to deliver 95% of the drug, we would essentially have to get down to about 5% of the initial drug not being delivered, right? So 100 minus 5% would be 95. 5% would be about 4.3 half-lives. Okay, so hopefully that makes some intuitive sense. If not, maybe look at this a little more deeply and Google drug half-lives, and I think it'll make more sense. But I have a feeling that that we should be able to figure this out. Okay, so liver metabolization rate is referring to how quickly the liver breaks down drugs, right? If the liver really rapidly metabolizes a drug, you're not going to get a lot of the drug reaching your tissues. And some of the examples of drugs that are rapidly metabolized are listed down here. Lidocaine is probably one that you've heard of. It's a local anesthetic. It's very commonly used. Verapamil, propranolol as a beta blocker, which is used for a lot of things. Actually, anxiety is one, and we'll talk a little bit about all of this at some point. Hopefully, it's a little ways away, but you don't really. I wouldn't say that these are going to be very important things to cram down on right now, but it's just nice to see some of the drugs that we're talking about when we talk about very rapid liver metabolization. So let's just break this thing down. What we talked about, we said that we had drug absorption, which allows drugs to enter into the plasma, and they may reversibly leave the bloodstream. They can, once we have drugs in the systemic circulation, they can distribute into interstitial fluid or intercellular. And interstitial fluids is just the fluid between cells, and intercellular fluid is the fluid in cells. Then we have drug is metabolized by the liver. We talked about that. It can be metabolized by kidneys or other tissues. And eventually, the drug and the byproducts of metabolism are eliminated from the body via urine, feces, or bile. So here is, again, another follow-up question. Hopefully you've been doing these and you're getting used to them, and hopefully you've been doing well. Again, my advice is always the same. You're not expected to know what nitroglycerin does, but read through this carefully and see if you can make some logical sense. Start by ruling things out of possible administrations. So you can pause the video here. I'm going to count down from 5, and then I'm going to go through the answer. 5, 4, 3, 2, 1. So the answer to the question is D, transdermal administration. And I highlighted a couple areas of the text that hopefully will give you a very clear reason as to why the answer is D. So if we read this sentence here, it is known that more than 90% of nitroglycerin is cleared during a single passage through the liver. So we know that this is a relatively rapidly metabolized drug, and to some extent, more than 90% of it is essentially metabolized through one passage of the liver. That's quite a bit. So we can probably rule out oral administration just from that, because it's not going to be a very effective administration technique, because we're going to lose a lot of the nitroglycerin drug. Also, nitroglycerin must be given in sustained amounts in order to be most effective. Well, that should ring a bell, hopefully, that the transdermal administration be most effective. Topical wouldn't quite do it, because topical administration would be a local administration rather than something that we would expect to be systemic to treat chronic heart failure. Intravenous administration would be systemic, but it wouldn't give sustained amounts. It would rather give a high concentrated dose, typically. And subcutaneous administration, very similar to intravenous. And those are options, but very unlikely that they would be the most effective when you have a transdermal administration available. And it does turn out that transdermal administrations appear to be the most effective administrations for nitroglycerin. Hopefully this video got you exposed a little bit to some very basic administration techniques and some of the very basics for pharmacology. In the next video, we'll go over a more involved discussion on the distribution of drugs in pharmacology. So I'll see you there.